Hey everyone, I'm Allison Brown, and I'm joined here today by Roger Thorpe, President of Thorpe Benefits. Hey Roger, how
Hello,
are you?
Allison. I'm great. How are you?
Good, good, thanks. We're back together today to tackle another question in our series of 10 questions you should be asking yourself to be sure that you have the most successful benefit plan. And
hmm
question number two is really, really important. And it's, do you have an established mental health strategy?
Yeah, it is a big one. And I guess the
Mhm.
first point here is no longer is this something you can, delay. It's an urgent issue. So there's been a lot of conversation about mental health strategy, but now we need
Mhm.
action. Your employees are expecting it, not only because they are really struggling in many cases, but they want you to step up and be public about what your policy is. And when your applicants are coming to you, I know that they're going to, behind the scenes, they're going to want to know what your policy is. They want to know that they're coming into a psychologically safe environment, right?
Mhm.
Um,
Yep.
so now once we decide, okay, let's start moving on this. Where do we start? We recommend a pretty simple model. It is starting with assessment of your organization's health, mental health in general. It can also assess the level of education that people have around mental health. So that you can approve or improve that also by going into some training, whether that's by individual training, like first aid training, mental health first aid training, or broader mental health education, and getting that up to speed. Then finally, you want to find a way to apply that knowledge into the day-to-day life of the organization. So whether that's through what people are doing in terms of personal development, the way meetings are run, there's lots of ways to sort of implement that in real life. And then finally, how do you measure whether you're doing the right thing? We think the best test is when you start to ask employees, tell us what you think about our mental health strategy. Do you know about it? And if, as
Mhm.
long as they can say, yes, actually, I know all about it, it's great. We have great support systems we can go to. We've been learning a lot, talking a lot about it. I really feel like our company or our organization is behind us on that. So that's the test. We would love that every organization could get to that level, within a certain amount of time. And that's a good goal to have. So
Absolutely.
bottom line is have a strategy, but then it's now time to act, do something, and then we'll measure the success later. So
Yeah, so important.
yeah, thanks, Allison. Okay,
Thanks, Roger.